Last week, a young patient with autism was accompanied on site by his assistance dog as a way to help reduce his anxiety of having surgery. Assist Dogs Cornwall claim this is possibly the first time in the UK that an assistance dog has been accepted into a surgical recovery setting. I asked the patient's mum what it means to her and her son to be allowed to have his dog with him.
It's made the hospital trip a lot calmer. It's made him be a lot more relaxed, and that he's actually a lot more reassured as well. And also for myself, because it's not easy going to hospital with any child, especially one with additional needs. And to actually have her, it's been quite a godsend, where normally he gets very anxious, can get quite aggressive, where he tends to run off, but actually it's where she's calmed him down a lot.
That's amazing.
Yeah.
Was it easy to be able to bring her onto site?
Yes, the team have been fantastic, so everyone was briefed to not sort of approach her while she's working, and yeah, she did really well. She walked all the way through, didn't batter an eyelid.
So what adjustments have you made in the oral surgery department to be able to accommodate this patient bringing in their assistance dog?
So this is quite an common occurrence for us, having to make reasonable adjustments for our patients, especially with the community list, such as the list today. We've spoken to the whole team and department to make sure that they're aware the assistance dog will be coming in with us today, and just to make sure that they don't approach the dog while it's working. They can make a fuss of it at any other time, but it's just so important for the patient to be made to feel at ease and comfortable during their time in the department. So yeah, that's what we've done today.
Absolutely. You haven't had to put any other special arrangements in together, like any IPAC arrangements or anything like that?
Generally not. It's fine with just going into the consenting room and our second stage recovery area. So Rafi won't be coming into our main recovery area because we've got other children on the list, but the consenting room and second stage recovery is absolutely fine.
Leave it. Watch me. Yes, take it. Well done.
What would you say to reassure colleagues across the hospital that it is possible to allow assistance dogs onto site?
I think the reason for us to make sure that everyone was aware of the assistance dogs is to make people aware how rigorous their training is. So Rafi has been trained or is going to be trained for 2 years, and then will come out of it with a certificate and a qualification and ID. And for us, it's a really key regional adjustment, but one we want to assure is safe. And we know there's people out there that aren't so comfortable around dogs, but these dogs are trained to be to a high level of sort of standard, and just will look after the person they're with and not interact with anyone else. So we just want to get the word out there. There's lots of conversations around assistance dogs at the moment, and thought it was really important to let people know.
How important is it to our patients to allow an assistance dog on site?
I think for us, it's an extra thing that we can now use, which is able to really calm a lot of our patients. Specifically with patients with autism, it's well known that animals have a very calming effect on them. And the patient we have that's come in today otherwise might be running around, might not have stayed in the department. Having his assistance dog with him has allowed him to be calm the whole way through, and hopefully if he comes back it'll be a less challenging environment, so that our aim always is to make this visit good so the next one's even better.